Thank you, everyone, for taking the time to join us today. Today we will have Rural and Remote Health, Addictions and Seniors Minister Everett Hindley, as well as Saskatchewan's Chief Medical Health Officer, Dr. Saqib Shahab, and SHA CEO Scott Livingstone. We will start with opening remarks from Minister Hindley.
Thanks. Good afternoon. As you know, our goal is to vaccinate a significant portion of Saskatchewan's population as quickly as possible. And while we still have a long ways to go, there is one segment of the population where we have achieved this goal, and that's seniors living in our long-term care and personal care homes. Our healthcare workers have now been to every one of these homes administering first doses, and to most of them with second doses, with just a few more to go. This was our highest priority when we began receiving vaccines. This has been an extremely difficult year for those seniors and for their families. We have all seen the tragic results that have occurred when COVID has entered seniors' homes across Canada, including a few here in Saskatchewan. That's why we've had to enact very tight restrictions on visits to long-term care and personal care homes. These difficult but necessary measures have meant seniors in those homes have been significantly limited in their ability to visit in person with family members, in some cases for over a year now. And this had to be done to protect our seniors. But it doesn't make it any less heartbreaking. I can tell you, as the Minister for Seniors, this is by far the number one question and the number one phone call and letter and email that I have heard and had come into my office. When can we visit our mom or dad, or grandma or grandpa, or aunt or uncle in the long-term care home? Today, thanks to the great work of our vaccine teams delivering shots to seniors in those homes, I'm very pleased to be able to answer that question. If at least 90% of the residents in that facility have been fully vaccinated, and 3 weeks have lapsed since the last second-dosed vaccinations, then starting on Thursday, April 29th, 1 week from today, long-term care and personal care home residents will be able to welcome up to 2 visitors at a time indoors and up to 4 visitors at a time outdoors. And it does not have to be the same 2 or 4 consistent visitors. 43 long-term care homes across the province already met this criteria, and many more will qualify in the coming days. Seniors who are fully vaccinated will also be able to leave the facility and return without having to quarantine. We have said many times, the road back to normal is through vaccinations. And I think today's announcement is just a small glimpse of what that looks like. We still have a long way to go down that road. So no, we can't fill up Mosaic Stadium just yet. But some of us can go see Mom on Mother's Day. And that's a pretty good place to start. But it is just the start. It's one small step in getting back to the people we love to see, and the places we love to go, and the things that we all love to do. And there is much more to look forward to. But the way we will get there, in fact, the only way we will get there, is if we all do our part when it's our turn and roll up our sleeves and get vaccinated. Earlier today, the vaccine booking eligibility age was lowered to all residents ages 44 and over. The booking system has experienced significant uptake, resulting in high demand for a limited supply of appointments, particularly in our urban centers. While some clinics throughout the province still have some appointment times available, a number of clinics, including in Regina, Saskatoon, and other locations, are currently out of appointment times. We understand the frustration that comes with not being able to immediately book an appointment where you live when your age group becomes eligible. This is the unfortunate result of not having enough vaccines. But I would like to assure eligible residents that as we receive more vaccines from the federal government, more appointments and opportunities to receive your COVID-19 vaccine will become available. This includes booking appointments through our mass vaccination system. It includes reopening our drive-through vaccination sites. And starting early next week, Saskatchewan residents will be able to access the COVID-19 vaccine in several pharmacies across the province. To start with, we are anticipating that 61 pharmacies in 13 communities will begin accepting appointments through their booking systems on Monday, April 26th. And a few pharmacies may even start to book as early as tomorrow. And pharmacies in these communities will begin vaccinating residents on Thursday, April 29th, with more pharmacies expected to come on board in the coming days and weeks. So, while we wait to receive more vaccines from the federal government for drive-thrus and vaccination clinics, we are asking for patience from Saskatchewan residents. And know that we are working to make a vaccine available to you in your community as quickly as possible. In the meantime, let's all keep protecting ourselves and those around us. Keep following all the public health orders and guidelines. Our case numbers and hospitalization numbers have started to trend down just a bit. The public health orders are working, the vaccines are working, and the end is in sight. This is the first COVID briefing that I've done, and so I just want to thank everyone in Saskatchewan for everything that you've done over the past year. And I want to especially thank our healthcare workers, those on the front lines treating COVID patients, the massive team we now have delivering thousands of vaccine shots each and every day in every part of Saskatchewan, and everyone else working in every part of our healthcare system, looking after Saskatchewan people every day. So thanks, everyone. And when it's your turn, stick it to COVID, and please get vaccinated. Dr. Shahab?
Thank you, Minister. So I will start with, again, expressing my sympathies to the friends and family of 5 Saskatchewan residents who have lost their lives due to COVID-19 since we last talked on Tuesday. On the other hand, I would, echo Minister Hindley's comments that, resumption of family visitation to long-term personal care is such a good news after this long year. And it really shows the way of what we can achieve once we get vaccinated. And we hope that this will expand not just to long-term care, but as Minister said, to visiting our close friends and family with increasing confidence over the next few months. But again, we have to do two things over the next 6 to 8 weeks. We have to get vaccinated as soon as our turn comes, and the enthusiasm is reassuring actually that when booking slots run out within a short time becoming available. But I think we need to make sure that we find the earliest slot we can when our age group becomes available, and we need to continue to follow public health guidelines in areas where we live to keep our numbers low. I think that is going to be critical to make sure that our health system is not overwhelmed, our vaccine clinics run smoothly, and then once all of us are vaccinated, those of us who choose to get vaccinated 18 and older, we can look forward to relaxing those restrictions as we see case numbers go down and hospitalizations and ICU rates come down as well. We again, investigations are ongoing with the cluster of the P1 variant. We may find some additional contacts linked to that cluster, which we expect to see. And there's been some travel restrictions from international travel due to new variants of interest emerging throughout the world, and that is going to be our reality for the next few weeks as all of us step forward to get vaccinated. And at the same time, we need to recognize that it's been a hard year for our seniors in long-term care, but the vaccination rates are remarkable, 90% plus in many long-term care facilities, 100% in many personal care homes. In the community, 80 and older, 85% plus vaccination rate, higher than 80% uptake in 70 and older. 60 and older are coming up, and now as 50 and older complete their vaccination rate, and 40 and older access vaccinations, and of course from next week, persons younger than 40 who work outside the home in essential workforces access vaccinations. We need to keep this momentum going so that everyone 18 and older who choose to get vaccinated gets vaccinated. And if we have a high uptake with every age group who's eligible, that will ensure that we can gradually come out of this pandemic. And for young people who may become eligible, over the next, if you're 18 and older, over the next, 3 to 4 weeks even, please watch out for when you're eligible and get vaccinated as soon as your turn comes. And for youth under 16 who are not yet eligible for vaccination, I just want to recognize it's been very hard. This whole year has been hard. Sometimes you can't meet your friends the way you used to. But again, the weather is great. You can do lots of things safely outdoors where you can maintain your physical distance, wear a mask if you can't maintain that 2 meter distance. But please do continue to take advantage of the outdoor. But do be careful not having large gatherings outdoors or indoors with sharing of food and other items, because we have had a super spreading event in the Southwest where we have now 40 plus cases linked to that, unfortunately, where normally if you had a gathering of 10 and not following protocols, you would have 2 or 3 individuals. With variants, you get 8 or 9 out of 10 infected. So again, we just need to just be patient for the next 4 to 6 weeks, stick with our public health guidelines, and of course, as our turn comes, get vaccinated as soon as we become eligible. And I would agree with Mr. Hindley that sometimes it can be challenging when you don't get a booking right away. But many of my people I know who initially said they can't get in, they were able to get in for a later date near where they live. So the system does reset and adjust very quickly. Thank you very much. Thank you very much.
Thank you, Dr. Shahab. Thank you, Minister Hindley. We'll now move to questions. We'll start with our first question on the phone lines.
We have Lara Fominov with CKOM.
Hi, thank you so much for taking my call. I guess my question would be regarding the age eligibility and the vaccine rollout right now. I'm just wondering, perhaps this question is for Mr. Livingstone. Why was the age eligibility lowered right now when there are so few vaccines? When there are so few vaccines, we've heard stories of people being number 500 on a phone line, number 200 on a phone line, not even being able to get through and being told you're simply going to have to wait. So why lower the age eligibility at this point when there's not around?
Scott, maybe I'll start with that, and then you can weigh in a little bit as well. It's a great question, Laura. I think the reason that it was done is because there are a number of communities in the province where there were still vaccines available. If you look at the map, in certain communities, as I mentioned in my opening remarks, we're out of vaccines in communities like Regina, like my own in Swift Current, but there's some smaller communities, rural communities that still had vaccines sitting on the shelf, but people not in a position to take the vaccines because they, the people living in and around these small communities haven't met the age requirement. So I think that's part of the reason there. But Scott might want to expand upon that a little bit further.
Sir, and just to highlight, one of the reasons we continue to drop the age categories is exactly why the minister has pointed out is there is available vaccine and available appointments, not in all communities based on uptake, but also to remind that some of the specialized targeted vaccinations, particularly in Regina and other areas of the province where we've been able to bring the age level down, means that there's communities in the province that have already vaccinated younger individuals. And what we're trying to do as we bring on pharmacies and prepare for the increase in shipments of vaccines that will occur soon, that we're actually keeping the province at relatively the same age rate across the province, excluding some of those special interest groups like our extremely vulnerable essential workers, et cetera, who also need to protect it. But it's also at the same time as we bring on pharmacies so that we're moving through the first doses as quickly as possible and not confusing folks with respect to the messages around who is eligible and bringing that to the public as quickly as we can. As the Premier said many times, if we had all the vaccines we would require to vaccinate the population, we'd have no criteria. But it's important to actually equalize that age group across all of the vaccination sites, including the new community pharmacies that will come online next week. And that's one of the reasons for dropping it. And we will continue to book appointments out and make them available as new vaccines become available.
Do you have another question, Lara?
Yes, please. I guess this is for the minister. Can you clarify whether the visitors to care homes also need to have 1 or 2 vaccinations, and whether there's any concern that if they don't have any vaccines, if there's no requirement for a vaccine, they may reinfect or reintroduce COVID into long-term or into care homes.
Yeah, my understanding is no. If the resident, as we've said today, has received both their first and second doses, and it's been 3 weeks since that second dose has been administered, that the visitors do not have to have been vaccinated. But that being said, the public health orders and all the measures that still have to be followed in terms of, mask wearing and temperature checks and screening and all that sort of stuff. That's part of it as well. There is always a risk that there for COVID-19 to get into a facility. There's no 100% guarantee, but we've reached this time here where a vast majority of folks have had that vaccine. It's been 107 days since Jimmy Favell in Isle of La Crosse became the first long-term care resident to get a vaccine, and it's been a long time that families haven't been able to spend time with their loved ones, and whether it's parents or grandparents, aunts and uncles, and as I said in my earlier comments, it's one of the most frequent calls that I've been getting to my office under this part of the portfolio. I've talked to folks back home how tough it's been to not be able to spend time with their parents and not to be able to see them except for compassionate reasons only. So that's been very, very challenging. But we've worked very closely with Dr. Shahab, and Dr. Shahab may want to offer some additional comments. But just in terms of where we landed today and what we're allowing at this point going forward.
We'll come back to the room. Wayne Mantica with CTV.
The ICUs are operating at full capacity in some centers. Are you considering, or do you have the capability of increasing the number of beds?
Thanks, Wayne. I'll just start off a little bit with that and then ask Scott, I guess, to comment on it. The ICU situation is a concern, of course. We're monitoring it very closely, and something that myself and Minister Merriman and the Premier and others have conversations with officials several times a day, just in terms of the overall healthcare system and what's happening out there. So we want to make sure that it's as the minister and the premier have said, it's a very difficult balance that we're in right now. We're trying to get people that's vaccinated as quickly as we can, because we know that will have a positive impact on the new cases and prevent people from hopefully ending up in a hospital or taking up an ICU bed because of some serious outcomes. So it's something that we're very well aware of. And Scott, you might want to offer some comments on just the capacity within the system.
Thanks, Minister. And Wayne, so we've talked a lot about how we've been working to expand ICU capacity provincially, which has always been part of the initial plan. But as you've heard me say too, the system is not working as it normally has, not for non-COVID patients or COVID patients. We are putting and stresses on the system that are unprecedented, particularly in Regina, where we're on bypass. We have a number of people in ICUs across the city. Concerns around what happens if that happens outside, but we are working hard to expand capacity. We have added 38 additional ICU surge beds province-wide and have used other spaces, as you've heard before, like critical care spaces for cardiac patients to use as overflow in ICU. We've been doubling up patients where we've needed to, which is not normal. Lots of stress, frustration, and tired staff across the province, but in particular in Regina, where they are feeling the very, very brunt of this. With respect to other bed capacity, to expand COVID capacity, Wayne, as you know, we have been doing service slowdowns across the province, and in particular more service slowdowns in Regina to accommodate more patients. We've opened up more COVID units in our facilities to care for those patients that aren't in ICU. But certainly the system is under stress without a doubt, and this is the most significant stress we've felt through the entire pandemic.
Do you see need to increase capacity? Is that under review, and is that even possible at this stage of the meeting?
Question, sorry?
Sure. I just want to know if you are then considering increasing the number of ICU beds, and maybe in Regina, Saskatoon in particular. Is this under review? And is it something you could even consider doing? I think I noticed a story from a year ago where you initially planned for, I believe it was 211 ICU beds. So that would lead one to believe that maybe this is something that could be done if we're so close to capacity or at capacity.
So Wayne, I just want to be clear. We've already expanded ICU beds. We've gone from our typical 79 to add another 38, and we're currently running at a high level of capacity within that number. So we usually run at 79. We have over 96 patients, I think, as of this morning in ICU across the province. That's not just COVID patients, because our ICUs also need to take care of those people from, cardiac events, strokes, accidents. So we've already aggressively expanded beds. We will continue to try to do that. We have, as you know, bought equipment and beds. We've talked about this lots on these news conferences over the last 1 year. But the challenge we're having is to have the right number of skilled staff, and we are struggling to have that occur. We don't have, we're not going to have unlimited ICU capacity, and we are stressed, particularly in Regina, more than we have ever been throughout the pandemic.
We'll take another question on the line.
We have Zach Becerra with the Star Phoenix.
Hi, thanks for taking my question. My first question is for Minister Hindley in regards to the relaxed measures in terms of long-term and personal care homes. I'm wondering how these are going to work on a more regional basis. There is the asterisk here that regional medical health officers can make determinations on whether restrictions need to stay. I'm wondering if that's going to be the situation in Regina, for example, given what's happening there right now. And also if that might be the situation if there are a certain number of staff or residents of long-term care homes who do not want to be vaccinated.
Right. Thanks, Zach. Yeah, in terms of the measures, and you correctly pointed out that there is a note that we'll be working care homes, long-term care, personal care homes will be working with the local medical health officers, because if there is an area perhaps where there's increased cases, for example, there will be a determination made as to whether or not we can proceed with this in these areas, but. Keeping in mind, I think that we know that this is something that's important for people. We know we need to continue to make sure that we're protecting all of our residents, and including those that are most vulnerable. But we've also been hearing that that people this has had. The restrictions that we put in place in terms of visitation, long-term care homes and personal care homes, and they've not been easy. They've been exceptionally difficult for the residents, for their families, and again, I've talked about some of the phone calls that I've taken, and they're not easy phone calls, and and nor are the ones where people have passed away as a result of COVID-19. But this is a reasonable step to take. We've always said since the beginning that our goal throughout this has been to try to protect the healthcare system so it's able to do its part, but also to be able to protect the most vulnerable, which in this particular instance, in this case, it's an age-based thing by and large. The older that you are, and if you have, if you're immune compromised, the greater chance are that there will be negative outcomes as a result of COVID-19. So it's why we've prioritized from the top down in terms of ages, working our way down and making sure that we can protect those residents. But people are, they have also been asking, what point can I see my grandparents or my parents in a long-term care home? At what point can we start to visit again? Because they've heard us as a government say it's important to get vaccinated, and that is very true. That is the only way we'll get out of this is making sure that everybody gets vaccinated, and we're fortunate to be able to say that for the most part we're at that stage right now with long-term care homes. There's I believe 43 that have hit that benchmark of both first and second doses, and 3 weeks since the second dose, and there'll be more care homes coming on board in the coming days and weeks that'll have reached that benchmark as well. So it's an important thing, I think, for people, but recognizing, of course, we still have to balance it out with with the public health measures that are still in place with respect to what's happening around the province.
You have a follow-up question, Zach?
I do. My second question is for Mr. Livingstone. Scott, you mentioned that Regina's ICUs are under unprecedented strain at this point in the pandemic. You said in the previous press conference that if what happens in Regina plays out in other regions of the province, then we are in big trouble. Can you walk me through exactly what happens if the rest of the province gets hit as hard as Regina, and if at that point we have to start talking about triaging care, for example?
So thanks for the question, Zach. So certainly based on the pressure in Regina, if that was to expand to other areas of the province because of the aggressive spread of the variant, certainly we would be in a situation province-wide where we would be struggling with caring for both COVID and non-COVID patients that are in emergency or critical care situations. There's just no doubt that that would be the case. And with respect to what it looks like, and with respect to the ethical framework, if we're in one of those situations where we have exhausted our ability to expand ICU, both from a staff perspective and providing safe care, we move into that area that I would describe more as a MASH unit, where patients are being triaged and decisions are being made by clinicians using that framework to appropriately care for the people that are more likely to benefit. And that, that's not just COVID patients. We have, elderly individuals still in this province that have been vaccinated that could suffer heart attacks or strokes or get in car accidents or be in some form of traumatic event that require critical care. And that would stretch the system beyond. So to give you an example, Zach, although we're not formally using the framework today in Regina because of the capacity challenges around ICU, surgeons are making decisions on a daily basis on what patients we can take to the OR, because typically those types of cases where there are open heart or aortic aneurysm or other serious types of surgeries, those patients end up in ICU after their surgery, and we're actually not able to maintain our usual daily types of surgery in that space because we just don't have the ICU beds on a daily basis to accommodate that.
And we'll take our next question.
We have Laura Sharpletti with CBC.
Hi there. Thank you so much for taking my call. This is probably for Dr. Shahab or Mr. Livingstone. I have a story that I'm writing about a man who he has lung cancer and it has quickly spread to his brain. And he was supposed to have surgery this week to remove the tumor, and it's spreading quickly. But now they just learned today that because the ICU beds are over capacity, he can't get the surgery. So what I want to know is, what is the province doing to really focus on helping these critical care patients that need treatment now? I know we spoke a little bit about it, but just what is being done to really narrow in on the people who need surgery now but can't because of the ICU situation?
So I think I've already touched on that, and then Dr. Shahab, I'll take that question if you're okay, and if you want to follow up. So like I said, every day, particularly in Regina, decisions are being made to appropriately triage patients and to provide them surgery where we can safely do so. And if that requires an ICU bed, we're limited capacity right now. That said, there are also still some options available to us, because it's not what Regina's experience is currently not the state in for example, Saskatoon. So if there was an opportunity, if somebody was stable enough to receive critical care surgery in Saskatoon, they may transfer. But this is exactly what I'm trying to say, is with respect to the pressure on the system right now from COVID patients in ICU and non-COVID patients in ICU, we're already in a situation where we're making those decisions on a day-to-day basis and triaging the most high priority patients that we can to make sure that we can care for them safely and provide them an ICU bed that they would need post that surgical procedure.
Do you have a follow-up question, Laura?
Yeah, I do. Just a small one. I'm going back to the visitation being opened up for long-term care homes. This is for Dr. Shahab. Did you recommend this change at this point in the pandemic?
Yeah, thank you. So I'll maybe make a few comments about the visitation for long-term care, and then a few comments about the ICU search from my perspective as well, if I may. So certainly, absolutely, like the minister said, we were looking for any opportunity that we could allow visitation in a safe manner. And we certainly have looked at evidence from other parts of the world, Canada and the US, and certainly the approach we have is a very safe approach where once you have a high vaccination uptake in a long-term care facility, you can safely start visiting, as we have described. Having said that, I do want to say that many people that I know who have loved ones in long-term care have gotten vaccinated, because if you're 50 and over, you're already eligible and they have received the vaccine. So that provides an additional layer of protection. Many staff members have gotten vaccinated, and that provides an additional layer. If you have any concerns before visiting, because you may have been exposed or may have any concerns, getting tested. Testing is widely available. If you plan to visit your loved ones in long-term care regularly, and especially if you haven't been vaccinated yet, get tested on a weekly basis. And if you have had one dose but think you may get exposed every now and then, again, consider getting tested. I think those are all additional mechanisms we can do over the next little while. And certainly the hope is that as more and more of the people who visit regularly are vaccinated, one dose and then increasingly 2 doses, further, the visitation guidelines would be further relaxed. But I think we're starting in a very careful way. But it is, all of our responsibility to get vaccinated, to not just protect ourselves, but to protect our loved ones, our family, and at the end of the day, our community, because our community transmission numbers are also reflected in how quickly we take up vaccinations. And secondly, further to the issue with ICU numbers, if we want to reduce the pressure in ICUs in Regina and throughout the Saskatchewan by next week, we need to take specific measures today, which we discussed last time also. If we can work from home. Many people since Tuesday actually said to me that, they reviewed what kind of work they do or what their employers do, and many have started working from home because they can work from home. Similarly, reduce your number of unnecessary visits out and about, do your grocery shopping, one person going if they can, in a systematic way when it's less crowded, very carefully using takeout and curbside pickup, minimizing a number of contacts, enjoying the outdoors in a safe manner. All these actions today can result in reduced ICU pressures next week. And we have already seen a plateauing of case numbers in Regina, rest of the province, but we need to get those numbers coming down, increase our vaccination uptake, but also do everything we can today to see those numbers coming down by next week. Thank you.
If I could just add there too, just to the first part of the question about the number of homes that will be eligible in this first batch. As I mentioned earlier, it's about 43 long-term care homes that have vaccinated over 90% of their residents in 3 weeks has lapsed. There's still about another 115 long-term care facilities that have not met these requirements just yet. Every long-term care facility and personal care home has been offered a second dose. It's just a matter of waiting for this 3-week time period after the second doses. And in terms of, so people, I believe the SHA will have the information on which facilities, because this is going to be on a facility by facility basis, but the SHA, I understand, will have that information on their dashboard, I believe, and how it will work is once the SHA has confirmed that a long-term care home has met the requirements, then they will allow that facility to notify residents and families that the restrictions have been eased in that particular facility. So it'll be fluid as more and more of these long-term care facilities come on board.
And we'll take another call on the line.
We have Mark Smith with CTV.
Hi, I've spoken with a couple of people from Regina today who attempted to book vaccine appointments and ended up booking them in Weyburn. With travel advisories in place for Regina to not travel in and out unless for essential reasons, why are people allowed to book vaccines outside of the city, and should more vaccines be made available in Regina to ensure people here can get vaccinated?
Thanks, Mark. And I'll maybe ask Dr. Shahab to comment on this a little bit as well. Yeah, it's a good question. It's a good point. As I mentioned earlier, there's a number of communities that, at least as of earlier today, when I was checking, that had appointments open for vaccine appointments, and probably some of those are now gone just because of the demand. And it's something that's a good thing that we have people wanting to get these vaccines, whether it's through a drive-through or an appointment-based or a walk-in clinic. The demand has been very high, and it is a challenge, but as we've said many times, this is how we're going to get back to normal. It's how we're going to get back to being able to announce things like we're announcing today, where we're starting to ease restrictions to allow more visitors to go and visit their loved ones in long-term care homes and personal care homes. It's allowing, in addition to that, it's allowing those residents to be able to leave their homes, to go out and go for a walk in the park with their family, or go for lunch at a restaurant in communities where they're allowed to do that right now. So that's an important part of this. But I'll maybe let Dr. Shahab talk a little bit about vaccines, and just in terms of people traveling for that outside of their community.
And thank you. So my recommendation would be that it's better to get vaccinated as close to your home community as possible, and obviously the booking system gives you a few options near where you live. Obviously, the way the vaccination clinics run are extremely safe, and if you obviously go to a neighboring community, because that's the closest clinic, the way they're set up is that as long as you only go to get vaccinated, the way they are set up minimizes any risk of transmission to the host community. But generally, and I'm sure Scott will confirm that, generally as these supply and demand surges, the adjustments to volumes of vaccine and appointments will always keep adjusting. Thank you.
Mark, do you have a follow-up question?
Yes. How are vaccines allocated throughout the province? How is it determined how many go to certain communities, and could that be adjusted with communities maybe seeing less people booking there to have more allocated to cities like Regina and Saskatoon?
Scott, do you want to talk about some of that in terms of the logistics of vaccine rollout?
I was going to add to that last question, Mark, but certainly throughout the immunization program, with an age-based model, excluding those targeted individuals, which we have many now, essential workers, healthcare workers, other frontline caregivers, our focus on long-term care residents in the far north. But other than that, the distribution of vaccines across clinics was done looking at a number of factors. And initially, it was also looking at the resurgence or high levels of COVID cases in certain communities. So, for example, the first AstraZeneca drive-through we did in Regina was done explicitly because of the growing number of cases in the COVID variant to give more individuals in Regina an opportunity to be vaccinated, to try to get in front of some of the variant cases. But overall, how it's done is it's a fair, transparent process, which actually looks at communities across the province and the number of individuals by age group that would qualify for vaccine, and then distributing the vaccine based on that basis. Now, that said, there have been instances throughout the program where we have made adjustments, to vaccine allocations to communities where we can, and there is available vaccine, because we know we have some high uptake. And as you know, in Saskatoon and Regina, in Regina in particular, where we lowered the age groups quicker than we did elsewhere. So with respect to an ongoing basis, we're monitoring it on a literally a 4-day window now, instead of booking out 2 to 3 weeks in advance as we get new vaccine. But the rate limiting factor to getting people vaccinated in all communities is the supply of vaccine. But we've been using the same methodology and applying the age-based criteria and allocating vaccine to communities that way. But we have moved vaccine, to your point, Mark, when it's not being used, and we have a 7-day window at the SHA through our immunization program. So once vaccine lands in the province, we're expected to deliver that within 7 days. So we have made adjustments to do that. If it's looking like some communities, we're seeing a little slower uptake.
Thank you, everyone, for taking the time to join us today. That concludes our availability.